Hey, it's Stuart Rammell with Pinnacle Pain and Spine. Today I want to take some time to talk about what are the options for people who continue to have back and or leg pain even after having had a surgery. Typically, surgeries in the lumbar spine or the low back consist of decompression procedures in order to release the pressure off of pinched nerves, or a fusion procedure for stabilization. Now, in many patients who undergo lumbar spine surgery, they have excellent results and they're able to get back to enjoying their lives. But there are some people, and maybe you're one of them, who has had a back surgery before, yet continues to be weighed down with back pain and or leg pain as well. So I'd like to take some time today to talk about some of the interventional pain options for treating these patients. Now, when surgery has been performed on the low back, one of the things that happens is that the load of the low back gets altered to segments above and below, where the surgery, most commonly a fusion, is performed. One of those areas where the load gets displaced to in people who have had lumbar spine surgery is the sacroiliac joints. The sacroiliac joints is a small joint where the pelvis meets the sacrum. This is a spine model right here. This right here would be the sacral part of the sacroiliac joint. When someone's had a fusion of the lumbar spine, then a lot of load will get placed on the sacroiliac joint, and that generally presents as pain in the lower back and buttock that will sometimes radiate down to the back of the thighs. Now, interventional options for sacroiliac joint pain is one, injection to put a little bit of potent anti-inflammatory or a corticosteroid in that joint, which can calm down inflammation and decrease pain. Also, when we do that, we'll put in a little bit of local anesthetic as well, which can help from a diagnostic standpoint to help see if that's where the pain is coming from. Now, this is a procedure that can provide some relief for these patients who are having sacroiliac joint pain despite having had a surgery in the low back, most often a fusion. Now, the diagnostic value of this shows us that if you get really good results with the local anesthetic being in there, then that indicates that treating this would be a good option for decreasing pain. So there are other procedures that can be done. One of them is an ablation procedure where we use radiofrequency electricity to ablate the small sensory nerves of the sacroiliac joint. There's also newer, minimally invasive approach to do a fixation procedure using a tissue graft of cortical bone placed in the sacroiliac joint. This is a very minimally invasive procedure with low recovery time and able to get you back to your daily life very quickly. The way the procedure is performed is through a very small, slightly less than 1-inch incision in the low back or buttock, where we access that joint, use instrumentation to put in a small graft that's made out of cortical bone that has demineralized bone matrix put in with it. And we insert that stabilizing device into the sacroiliac joint, and then everything comes out. Since it's a tissue graft, this will incorporate itself into the joint and allow for fixation and stabilization of that joint. This is an excellent option for people who are wanting some long-term relief after or from having sacroiliac joint pain. So if you've had a back surgery and you're having pain that's fixed right in the lower part of the low back or in the buttock, this is a procedure that we could discuss and you might be able to do very well with. Now, many patients who have had spine surgery will also note that they have back and leg pain that feels like a burning type pain that we describe as neuropathic or from irritated nerves. A really good option for this is something called spinal cord stimulation. Spinal cord stimulation involves implanting electrodes into the spinal space to sit right on top of the fibrous sac where the spinal cord and nerve roots run, and we induce pulses of electrical current over the spinal cord that modulates the way that those inappropriate pain signals are being sent from the periphery and can offer patients significant relief. The way that it works for this is we'll initially do a trial period where we will put the electrodes in through the skin using small needles very similar to other interventional spine injection procedures that we do, place them in the right space under a live x-ray, and then have you wear the trial leads for about 5 to 7 days on average. And if patients get excellent relief from this, then we would consider doing an implant procedure. This is a model right here of what it looks like with those electrical leads sitting within that space and they sit just on the outside of that fibrous sac where the spinal cord and nerve roots run, so we can have that access to induce an electrical current right over the spinal cord itself. If the trial is successful and patients see significant reduction in pain, improvement in their function and their ability to do their activities of daily living, then we would proceed with an implant procedure where we would actually implant these leads with a small incision in the midline underneath the skin and anchor them down, and then we would tunnel the leads again under the skin into either the lower part of the flank or in the buttock, and insert a small battery device, that which would be implanted under the skin, that would allow that therapy to be with them long term. Now, there's many advances that have been made with spinal cord stimulation, especially over the last 10 years, where we've seen tremendous amount of research go into this, and there's really a lot of more advanced programming options that are available. So if spinal cord stimulation is something that you have not heard about, but you've had a back surgery and you're continuing to suffer from back and leg pain, this is something that we could talk about and hopefully be able to get you some relief from. Or if you have had, or if you've had considered spinal cord stimulation in the past and didn't do it for whatever reason, it would be a good time to revisit that as an option, and we can discuss that further, especially with all the new programming parameters that are available. So these are two more advanced interventional pain options that can be especially applicable to people who have had previous lumbar spine surgery and continue to have pain. Often we'll also see that despite having had surgery, sometimes repeating the standard epidural injections, or sometimes doing a radiofrequency procedure to treat the pain that's coming from the small joints in the low back, depending on what surgery it was that the patients had, that sometimes that can be enough to knock the pain back down and get patients back to doing what they want to do. But if more advanced options are necessary, then those are great options and can provide patients with excellent results. So if we've talked about this before and we're in the process of working towards one of these interventional options to treat your back or leg pain despite having had surgery, then I'm hopeful that we can get the best results possible. And if this is something that we haven't discussed yet, please come into my clinic and let's sit down and have a discussion to see if these options would be something that would be helpful for you. So I'm always grateful to have been trained in these modalities in order to improve the lives of my patients, and I look forward to being able to help as many folks as possible. Thanks.